Next, it's time to introduce our keynote speaker. Luckily, we are not tackling climate issues alone here in Finland. Around the world, there is active discussion how the healthcare sector impacts climate and how we address the climate crisis. And it's clear that this challenge requires cross-border collaboration. One of the pioneers in this field is Executive Director Sonia Rosnik from the Geneva Sustainability Center. She is an expert on environmental impacts of the health and social care sector. Welcome, Sonia.
Thank you. I never think I'm an expert. So I'll just say, because we're all at the beginning of the learning curve, this is going to be such a long journey. And I'm sorry I don't speak Finnish, and I'm also going to sit down because I've got a bit of a sore back, so my apologies. Anyway, I'm delighted to be here, and thank you to Michaela and all the organising team for putting this on. It's wonderful to know that this is happening in Finland, that you're all coming together to sort of look at how we can make progress, because it's true that what everybody is doing can be inspirational to others. And so I hope that during the course of today, you get all the inspiration you need. So, the Geneva Sustainability Centre, this is just to let you know a bit of context, is part of the International Hospital Federation. There are 3 members in Finland that are part of it. And if any other organisations want to be part of it, you're very welcome. It's a great place for knowledge exchange, sharing on all aspects that are linked to healthcare. The IHF has been around for 90 years. The Geneva Sustainability Centre has only been around for not quite yet 3 years. We're very new on the ground, and it's because IHF members said we need help to tackle this. And it's the IHF is mostly constituted of healthcare leaders, and they really suddenly said, actually, we need help with this. So I'm going to try and tell you a little bit about what we do and why it matters to healthcare and why we focus on executives. One of the things that we feel about sustainable healthcare is that it really needs to be part of every aspect of healthcare delivery. Wherever you're working in the healthcare sector, this is something that every decision will impact on. So the IHF has actually put out a statement saying this should be included in every aspect of everything you do in healthcare. Now, that's actually quite an easy statement to make. It's quite a lot harder to implement. So maybe we can pick up on some of that. And if I would like to just tell you a bit more about what I mean by sustainable and resilient healthcare, it is a lot more than just low carbon delivery of healthcare. It is about how we do it in a resilient and equitable way. And I really do believe that it contributes to quality of care and it contributes to better health. This is a win-win-win-win-win situation across the board if we manage to pitch it right. And so just to remind us, we can't have good individual health without having good planetary health, good community public health. They're all interconnected. And the other thing that's amazing to me is that if we really want good, sustainable, resilient, healthy people and places, there are so many different points of entry. We can reduce our environmental impacts, reduce our climate emissions, of course, but we can reduce inequalities in our society. We can also work on reducing the burden of disease. And we can improve lots of things. We can improve our health and well-being. We can improve our natural environment. We can improve, build on all our social values. And I think sometimes we forget this is if you think about net zero, it's such a negative term, isn't it? How do we get to zero? It's not inspiring. I get up in the morning because I want to make the world a better place, So let's try and make this net zero something that sounds good, not like we're going to miss on something, because actually we're going to improve things. So that's the main thing. Having said that, healthcare's climate footprint, we often say it's 4 to 6% of emissions. I feel that doesn't mean much to me. But when you think that that is more than aviation and shipping globally put together, then you think, okay, we're a sector that matters. We should be held to account. What are we doing about it? So, we need to really get going. And I guess where we're lucky or unlucky, whichever way you want to look at it, is that climate change really impacts on people's health. This should be our core business. We're here to deliver better health. So, let's get going on this. It's part of what we should be doing. And we know that the health benefits of doing something about climate change far outweigh the costs of meeting any climate change goals. The trick is, the sooner we do it, the better, and the less costly it'll be. So, the message behind that is let's get started. And I guess the other thing that I'm passionate about, because I've got a training as an occupational therapist, is that I really believe this should be fundamentally integrated, embedded into quality of care. It's a dimension of quality of care. It's not something that you do on the side when you've got a bit of time. So, and if you look at it like that, then you can look at the value of care in a different way. You can inscribe it in that the outcomes for patients and populations is related to the costs, environmental, social, and financial. So it's not just one way of counting it. We need to be able to integrate these calculations. And, there's some places that are starting to do that. What is the cost of care? What about the carbon impact of ineffective care? If we could just get rid of that, you could get rid of quite a lot. And we forget that there are some elements that we could do quite easily. So, and I just wanted to remind you that I know that you've got integrated care systems, maybe not in Helsinki, but most of the other parts of Finland. And they actually, everything, all these things that are up here, they all fit under the world of sustainable healthcare. They're all aligned. There's no negative here. So, everything that you're focused on your population, that you're putting people at the heart of your healthcare, you've got resilient communities, you've got digital, so all of that fits into what we're trying to do. So, and the other driver really is, and this is an example from Geneva where we're based, where they're really trying to make sure that this gets integrated into the very elements of clinical care, because we focus a lot on leaders, but actually this is going to have to be part of everybody's way of doing things. And, I'm sure that you've got some great examples, and although I won't understand them all, I'm looking forward to seeing the slides later. I'm going to skip this slide because I know that there's a hospital locally who does a gloves off campaign. But the reason why I sometimes put it in, and you'll get the slides later and you can see the video, is just to say that sometimes it's not sustainability experts that drive things. This was the infection control nurses. They saved within 10 months, several tons. I think it's 21 tons of plastic just through changing their behavior. And so when we talk about procurement is very much not just the fault of the people who make things. We use these things and we dispose of them, and we are very much in power of how we use and dispose of things. So we mustn't ever forget that it's a partnership. If we are buying things, it's our responsibility. It's not just the people who are making things a responsibility. So we really need to work well on that one. Now I'm going to show you, because I've worked a long time in the NHS sustainability roadmap, and it's interesting after having seen the previous graph with, where Finland's going on its emissions. This is a graph of where the health sector in the UK would be going, and then you've got the list of all the different things that need to happen to try and bring it down. The top bits are things that government are going to do, impact on energy, on transport. But you can see that if we don't do things in the healthcare sector, it's just not going to come down. And we really need to implement things that are very specific and go into more innovative ways. So the basic message on this is actually, if you put in all the different things that government are doing, that healthcare can do, and the innovation, you can get to probably 90% reduction. It's hard. Getting right all the way to net zero will take a little bit more effort. But in our sector, we can't use the excuse, oh, healthcare is good for people. We really need to put in our effort as well. And globally, I haven't said that if we don't do anything, our emissions will treble. So we really have some responsibility to do something about it. And I guess, we know there's a lot of things we can do. And one of the hot spots, for instance, is inhalers. I'm just bringing it up because I'm interested in how systems work, and obviously I know that in Scandinavia you're much better at not prescribing inhalers that have got that terrible gas in it. In the UK, people are really bad at prescribing it. 70% are prescribed in that way. But the thing that moved industry was the fact that it wasn't guidance, it wasn't good case studies, it wasn't trying to speak to doctors. In the end, it was the top national sectors incentivizing GPs to change their practicing habits. I'm really sorry to say they were motivated by money in the end, and that was disappointing. But it was only when doctors were motivated by money that industry started to think this is getting serious. Disappointing, isn't it? I mean, really, I would have hoped that we could have done better than that. But anyway, that's just, there you go. And then this is interesting because there's various case studies here from Singapore just to make, but you know, the message I'm trying to say is there's so many different areas that we can implement change, make it work, not just for the environment, make it work for improved health, make it work for reduced finances. And I've got 2 more slides that have got a sort of return on investment kind of bias to it, just to say finances is not the excuse. In the UK, when we started, the first sort of anti-barrier, whatever it was finances. The second one was patients don't care. So let's just tackle the patient, the finances. These are just some examples. I'm sure you've got loads as well, but actually you could save money by doing this well. And it is a bad excuse to say that it costs money. It takes organization, energy and effort to get organized, but there are ways of getting money back from doing these things. And yeah, here's another set of ones. You know, different ones from different places. And just the Filipino hospital, I mean, you know, that is a lot of money for the Philippines annually to save on a change in some of their equipment. And that's without even counting all the other things that could be changed. So the other thing that I think, I haven't mentioned patients. I'm a patient, I'm sure a lot of you are patients. And we tend to go to our healthcare people and we never say, you know, what are you doing about this? But actually that would be a very powerful voice on top of our voice as healthcare professionals. And I know I find it difficult to speak to, you know, when you're in the heat of the moment dealing with your care, it's difficult to ask those questions. But I just wanted to add in, as when we did a survey of people and whether they thought the healthcare system was sustainable or should be, unfortunately, fortunately, they all said, you know, of course this should be the top priority, it's really super important. But unfortunately, it came across as they thought we were doing it already because we were the guardians of the state resources. That was really humiliating because actually we were not doing it very well at all, and we've still got a long way to go. And so the expectation that this is being integrated is there, and it's not actually there. So we've got some work to be done. At different professions level as well, I've just picked up this one from occupational therapy, but this is from the World Federation of Occupational Therapy. Different professions can, you know, put in place mechanisms to make sure that this is integrated into professional practice, not just into their daily clinical work, but also into professional practice. And that's part of some of this scaling up. How do you really get this going at a much higher level? So the other thing that we've been working with is looking at making sure that accreditation standards in the world for hospitals include sustainability as a compulsory part of accreditation. Now, at the moment, it's just with the Joint Commission International, but anybody who wants to use those accreditation standards, and these are the chapters, can apply them and make sure that they've got that level of, demonstrate that level of engagement. We've gone a step further to doing a healthcare sustainability certification, which is for those hospitals who want to demonstrate that they've gone a step further. And actually, this was just launched this year, and the first hospital has been through in Singapore and has just achieved the certification, and there's quite a few more that are in the pipeline. But it's a way of trying to say to hospitals, look, you need to really, this is part of accreditation, this is part of raising the standard, everybody should be going to do it. And the way we look at it is we use a sustainability accelerator tool, which is like an improvement tool that sits behind the accreditation and certification to say, these are the elements that you need to be working on if you really want to start making an impact. You don't have to be good at all of them, but you know, actually it helps to start looking at what you're doing on environmental impact, what you're doing in terms of health equity and well-being, and understanding what's going to happen to your populations in the face of climate change, and then what are you doing in terms of leadership and governance and how you're supporting people in that way. So all of this to say that in the IHF and the Geneva Sustainability Centre, we really feel that sustainability is a leadership competence. It's not a checklist that you do something when you've finished everything else. It's a leadership competence for the future. We all, as leaders in this room, everyone, needs to integrate it as a leadership competency. And the IHF has revised its leadership model recently to include actually some extra ones, which are these ones that are in green. And you'll recognize, I am sure, how necessary these are in a leader of a hospital or in any healthcare institution to start integrating. And I think if you start looking at it as a competency, it takes it easier to say, well, actually, this is my leadership journey. This is part of my professional development. This is how I'm going to train up me, my workforce, other people around this. And I would strongly encourage you to think of it that way, because this journey is going to be ongoing for quite a while. We're not going to be stopping anytime soon. We're only going to have to accelerate. There's only one direction. So that's really one of the main things I want to say. I am going to just do a little bit of advertising because there is a World Hospital Congress in Geneva. It's in Europe. It's not that far away. And it's really a great opportunity to come and share what you're doing. There's some awards. I mean, the abstracts and awards have closed for this year, but it is worth being part of a community who want to share what you're doing in that sense. The Geneva Sustainability Centre is doing a lot of different things in terms of how we support leadership for sustainability. You're welcome to join us. There's a lot of different elements that we're doing, so I won't go on about it now because I've mentioned some already. And also we've got some getting started guides, because what we realized with a lot of hospitals around the world is actually people know about climate change. They know they need to do something, but they don't always know where to start. And I would suggest, and this is maybe, I'm sorry if I'm going to say something that people won't like, but I would say don't start with calculating your carbon footprint. Start with doing something. You can calculate your carbon footprint and your impact in time as you're doing it. But actually, some hospitals waste 2 years calculating their carbon footprint. And those are 2 precious years where we could be doing things. So please, this is a reminder. There's lots of points of entry. There's lots of things that will impact on our overall healthcare sector footprint. It really matters to healthcare. It should be our core business. So please, let's see it not about doing less harm, but about doing more good, because that's what gets me up in the morning, and I hope it's what gets you up in the morning too. So there you go. Any questions? Over to you. Thank you. I hope I didn't speak too fast.